The treatment for schizophrenia-induced retinopathy is treating the underlying cause. And to treat that underlying psychosis, we use antipsychotics, which are found to have diminishing effects on the ophthalmic symptoms as well as schizophrenia. However, we should always keep in mind some of the effects of some psychiatric medications on the eye. We will specifically cover two medications of antipsychotics and also give the general side effects. First, thyroidazine is a first-generation antipsychotic which has been withdrawn from the market in 2005 because of severe cardiac arrhythmia that it can cause. Thyroidazine can also have adverse effects on the eye, such as decreased vision and dyschromatopsia, and eventually it can also lead to pigmentary retinopathy as well, which we will cover in this slide. Secondly, chlorpromazine is another antipsychotic, and it can cause cataractous changes in the lens, although this is quite rare. Generally, antipsychotics can also cause transient blurred vision, transient dilation of the pupils called mydriasis, blepharospasm, which is a term for eyelid muscle spasms, and pigmentary retinopathy. This is a pathology with pigmentary spots, dark spots all over the retina, and it can lead to degenerative retinopathy. The prognosis of schizophrenia-induced eye abnormalities are unfortunately not well studied. One of the factors that contribute to the uncertainty is because the patients with schizophrenia do not routinely obtain ocular exams. Nevertheless, it is known that schizophrenia is not a curable disease. So this is something that needs to be constantly monitored. And when symptoms arise with these psychiatric conditions, managing them appropriately is important for the patient's quality of life and their ophthalmic health as well. Regular eye checkups with ophthalmologists is also important. We have covered a lot in this presentation, but the main message is to establish a link and inform of this link between schizophrenia and the eyes. In summary, there are two main categories: abnormal eye movements, where there are also impaired smooth pursuits and limited exploratory eye movements. And second, retinopathies, so wider retinal venules, RNFL thinning, and also reduction in macular volume. Lastly, increased perception of brightness and color intensity, which leads to decreased contrast sensitivity. There are also studies that found correlations between schizophrenia and other eye diseases. And this has not been extensively studied either, but schizophrenia is associated with lens opacities and cataracts. And in the front of the eye, there can be pigmentation in the cornea. And the second point is the relations with strabismus. Children with strabismus, which is a misalignment of the eyes, they can develop schizophrenia later. And also those with schizophrenia are also at a higher risk of developing strabismus. Overall, the link between the eyes and schizophrenia is quite promising. When the research becomes more extensive and we get to characterize these general findings more and more, this might be a way to detect and diagnose and treat earlier some of the psychiatric disease, including schizophrenia. There is a saying that there is an expression that says the eye is a window to the soul, and that might be quite literal if you look at the series of studies. So specifically, ophthalmic findings can be used as biomarkers. The unique eye movements, the diminished visual acuity while other sensory functions are intact, widened retinal venues, of course, thinning of the RNFL, and abnormal ERG waveforms, among others. These are quite a characteristic finding according to the studies, and they can be characterized in a more specific manner in the future. This is a summary chart of everything we talked about in this presentation. I hope you find this helpful. And lastly, here is the reference of all the resources that we've used to put this presentation together. Thank you for watching.